name is Jomar Lunde. Today I present to you the topic that I will choose in the given topic by Sir. So among of the 8 topics, only one that I will choose, which is the drug dependence. So first, I will give the introduction about the field of practice. So drug dependence are a person who, as a result, periodic or continuous use of drugs have developed a physical or a psychological need for independence on these drugs to the extent that their denial produce adverse effects on themselves. So the next question is, what makes the field of social work particularly unique, challenging, or interesting area for professional practice? So social work is more than a job. It's calling. An individual has to help others, often in the face of difficult and stressful situations. Although social work love what they do, and the difference they are able to make the reality is that occupation is very challenging. Among the hardest things about working as a social worker are the emotional stress that comes with seeing the extreme of injustice and abuse. The challenging of working with vulnerable and marginalized clients population is the stress and physical injuries. So the next is the role and function of social worker in that particular field. So if in case of intervention for a loved one, social work are the great resources to pull on to help you navigate through what this process look like. Second, social work can also be referred to and serve as a therapist or professional trained in the use of the therapy. They can also serve as a surrounding bound as well as a human for and direction. So last is my insight about the drug dependence. My insight about drug dependence is drug dependence involves physical, mental, and spiritual damage. Drug abuser feels that they drugs is a part of them or their daily lives. Drug dependence is a disease that gradually increase. This increase not may cure but can only be controlled. When our current president, Rodrigo Duterte, was elected as president, one of his platform or promises about the drug on war. Last 2016, thousands or hundreds of drug users are surrendered. And we all know that drug is not good. It can damage our health. Last 2019, I was one of the facilitators for the community barangay rehabilitation program. I've learned a lot facing those peoples and handling with them is not an easy job or obligation. But what I did on the time as Sangguniang Kabataan of my barangay is to do my responsibility and help my barangays, and especially our president, also about his programs drug on war. I was challenging on the time. I fear actually, but what I did is to accept them, to accept these people and help them to recover through along the way. Handling 100 persons who rehabilitate is not easy, but because I understand them, their situation, everything will go smooth. As a future social worker, what I'm going to do is to help them realize about the better future that they have. Help them to guide them through the best way we can. And as a social worker, know the negative and positive side of them. And most of all, accept them. Lastly, we can do anything if without Lord Jesus Christ, our personal Savior. Let's all commit everything to God, because God is a great healer. Because social worker, we can teach people anything, but we can help them to discover within themselves. Thank you, and once again, God bless us.